It took me about 2 years to get a diagnosis. First of all, nobody believed me at first. No one could figure out what was wrong. And then my mom, who has been my health advocate, actually had heard about POTS from a family friend and took a list of symptoms to our primary care and had her take a look at it, who referred us to a cardiologist, who referred us to a dysautonomia specialist, and that was that.
I was diagnosed with POTS in March of 2016 when I was attending the University of Notre Dame. As a scholarship track athlete, I was as healthy as I could possibly imagine. So the POTS event was completely unexpected and very unusual. Not that it's expected or usual for anyone. So my symptoms came on suddenly in March 2016. I woke up and I'd gradually been experiencing worsening fatigue, and so I had to take leave from the track team. And so it was about a month where I hadn't been active at all. And then overnight, I couldn't digest anything, I couldn't temperature regulate, I couldn't sleep, I couldn't be upright for more than about 30 seconds. And it was, as we all know, extremely traumatic and terrifying. So I was actually diagnosed in 6 days because we had a doctor at the university's St. Liam Medical Center, which was our students' medical clinic. And they had been familiar enough with POTS to actually do an orthostatic test on me and recognize what was going on.
It took me 10 years to have a diagnosis here in the US. It was a really long and difficult process.
In 2014, I got up during the night because I was not feeling well. I ended up passing out, landing on my face on the hardwood floor. The impact sheared my brainstem, caused a traumatic brain injury, and it actually broke my neck, but that went undetected for 6 months. Because of the injury, I was unable to work. I can no longer hold a job because I can only hold my head up for a few hours at a time. I have to rest a lot, and it came with a lot of additional illnesses. It took them 6 years to figure out that I had POTS or dysautonomia, and that's what caused me to pass out to begin with.
It took me a long time to be diagnosed. I had symptoms through childhood, through my teenage years, but all the doctors were really just saying I was just a dramatic teenage girl. But I was honestly already doing the treatment for POTS, which is, increase your salt, increase your fluids. I was literally eating salt out of my hand, not knowing that I was helping myself. Once I started my nursing career and everything, that kind of died off a little bit, and the symptoms started coming in full force. So I was finally diagnosed October 1st of 2015.
I was diagnosed with postural tachycardia syndrome in 2019. It took me quite a long time to be diagnosed with postural tachycardia syndrome. It started when I was 40 after a virus. I was getting tachycardia when I stood up, and I had gotten diagnosed with fatigue and tachycardia and Hashimoto's, but they didn't know what was wrong with me, why I was getting tachycardia. So they just put me on beta blockers and anxiety medicines and thyroid medicine. And I still kept trying to find out why I was getting tachycardia and feeling the way I felt and getting headaches and different things, but nobody could figure it out. And they kind of, some of the doctors were pretty condescending. The cardiologist was nice, but he just couldn't figure it out. So it just kept giving me different medicines to control my tachycardia, which was mostly beta blockers, which I didn't really like too much. In my 55, I got really bad tachycardia again, to the point where it was really preventing me from even being able to function. So I went to different doctors, searching and searching, and finally went to an endocrinologist at the Cleveland Clinic that said, "Have they ruled out POTS?" And I'm like, "No, like, what is that?" So she ordered a tilt table test. I got the tilt table test at a cardiologist's office where I lived. They would not diagnose me, but I had tachycardia when they tilted the table up. So I went to see a dysautonomia specialist and an electrocardiologist, who both diagnosed me with postural tachycardia syndrome and autonomic dysfunction. I also had GI issues since I was a child. So I had motility issues, chronic headaches, fatigue, temperature regulation, all the signs and symptoms of dysautonomia and postural tachycardia syndrome. I had the hyperpots, which is why I always looked like I had anxiety and got told it was in my head and I had anxiety. disorders.
It took me about 10 years to reach an official diagnosis of POTS. I started experiencing symptoms when I was about 14 and received a vasovagal syncope diagnosis when I was about 20 in college. And then from there, I was on a hunt to figure out sort of the root cause of that and if there was anything else going on, and didn't receive my POTS diagnosis and autonomic dysfunction until my mid-20s. So it was about a little over a decade.
For me, the diagnosis process was 7 months, which I know a lot of patients wait a lot longer, especially back then. 15 years ago, I was diagnosed with what the doctor called at the time general dysautonomia.
My life has changed a lot since being diagnosed. I was 12 at the time, and in the midst of finding my independence, finding out who I was, and this really caused me to be very isolated, very lonely. My friend group changed dramatically. People didn't want to deal with my symptoms, and I was really worried about my future. I was worried about being able to work, being able to have any independence, supporting myself financially, and being able to be social at all.
Since the moment I was diagnosed, my life changed a lot, physically and emotionally. I was really confused and I didn't want to accept a life with a chronic illness. It affected my relationship with my family and friends, and I had to change my lifestyle completely in all aspects.
A lot has changed since that accident in 2014, but I'm a much better person now. I had to lay flat in a bed for 23 hours a day for almost a year, giving me lots of time for introspection. So I have learned a lot about myself.
Life has changed with dysautonomia POTS. I went from being super independent, nursing as my job, to being a professional patient myself. I have other comorbidities along with this. So I've got Ehlers-danlos syndrome, gastroparesis, trigeminal neuralgia, migraines, interstitial cystitis. There's just a whole bunch of things that go along with it. So financially, I have disability, so that helps out a lot with the medical bills and everything. And I'm very thankful to have my husband who takes care of our other bills. I couldn't do it without him, honestly. It's very difficult being disabled and trying to take care of yourself. Socially, I'm not able to get out as much as I was. I have to kind of really think about what I'm doing and what I need to be doing. So if I have something big that I want to do, I kind of have to save up the spoons for that. Emotionally, I have depression, I have anxiety. My doctors watch that, manage that, and I'm working on getting to see a therapist.
I wound up having to go out of work on disability and worked very hard. I've been working very hard to manage my symptoms. I've a little better. I've gotten little bit of a better quality of life, but it's still not able to work full time and carry on like I was or want to. I felt a big loss, and of course I don't make the money that I used to make, and it's been an adjustment.
As far as how my life has changed physically, emotionally, economically, all of that, it has put me out of work, traditionally at least. I currently am a stay-at-home mom. Thankfully, my husband works from home, so that's helpful. And I am working to build my own business eventually that I can work out of the house and do sort of on whenever I'm able to. So work has been changed. Emotionally, I think I've become more understanding of other people's invisible struggles, and just in general, people dealing with things that are unseen, whether that be chronic illness or grief or other, life problem. We're humans and we deal with our fair share if we live long enough.
And what was really hard for me was that even after the diagnosis, the doctor said that I would just grow out of it in a couple of years. And there wasn't any discussion about what I could do to feel better or what I should do to kind of move forward. So I just waited, and I just rested and waited to get better, to one day wake up and all of my pain and fatigue and dizziness would just be gone, and then I could get back to life. And when I realized that I wasn't going to just wake up better one day, then I was able to adjust and get my life back piece by piece. And I went to work, I got married, I had to leave the workforce, but I was able to adjust again and to move forward.
Things that have helped me the most, most definitely finding other people who are in the same situation, feeling like you're not alone, that others are going through the same thing, as well as, the typical salt, compression tights, water, all that stuff. But mainly the sense of community that organizations like Dinet really bring, because it's important to know that you're not alone and that what you're going through is very valid.
I went to Memorial Hospital in South Bend, and Dr. Mark Walsh and Dr. Collins walked me through a whole bunch of options. Dr. Collins had several daughters that had been struggling with POTS and found ways to improve it. So she offered me a ton of diet and lifestyle changes and exercise as well. Actually, it was a huge benefit for me. Very gradual, like being on the recumbent bike for 30 seconds was my first workout. And eventually got back to running. So there's a bunch of diet and lifestyle changes that I implemented that over the next year and a half got me back on the track team, nearly in the same shape that I had been in prior, which was amazing. But one thing I really wanted to speak to, how I'm coping with chronic illness now, is that I do not identify as someone that has POTS anymore, because I got severe long COVID in the last year. In 2022, I nearly died. And as a result of that, I started seeing a functional medicine doctor who saved my life, Dr. Summer White, here in Nashville, Tennessee. And at that point, POTS wasn't even on my mind with long COVID. But it was part of the reason that my immune system was already so fried and allowed for such severe long COVID in my case. So she actually found that the root cause of my POTS specifically was an HHV6 retrovirus that had been living in my vagus nerve. And we were able to get the virus to go dormant. And when the virus is dormant, I do not have any POTS symptoms at all. I don't think about it, not a single symptom.
What has really helped me feel alive is my faith in God. He's the only one who has helped me get through this process and who gives me hope every day to continue my battle against dysautonomia.
I have learned how to look within to find the answers that I seek, and I now pour in more motivational, uplifting, encouraging messages than I ever have before. And that's how I have been able to go from being completely incapacitated to now empowered as a successful business owner.
Things that have helped me adjust to this life as a chronically ill person: a beautiful support system. My family and friends have been nothing but supportive, and I can't thank them enough, honestly. Mobility aids have helped me adjust as well. Being able to use my cane or wheelchair if I need to is still kind of hard to grasp as a 29-year-old. The issue with that is that you get judged being so young and everything, or you get the pity looks, which is a little bit hard emotionally with that. But just having the knowledge and the support systems and support groups, even that out there, it has been fabulous and helped me adjust.
Mental health counseling, which has helped me a lot. And I did it for like 2 or 3 years, and I go to it as needed. And my support groups online help a lot. And I just do whatever I can to try to help others and to get support online through groups.
Part of the next question, what's made me adapt and sort of find my footing in managing chronic illness, is helping others and relating and connecting with others who have been through similar struggles. So, connecting with other POTS patients or people with dysautonomia or chronic illness and helping, swap tips or just even talk to them and help them hopefully feel less alone in this, because they definitely are not. Other measures that have helped me adapt. I do sleep with a bed wedge most nights. That helps me elevate my feet for at least some of the night, help with that blood flow back up to the heart. Keeping my legs pretty toned, whether it's just by walking or other exercises, helping that, muscle skeletal pump. Increasing my water, which I've got some right here, and my salt intake. Obviously, those things alone are not the cure-all, but definitely upping those helps a lot. A little bit of medication, as I mentioned, exercise, and just keeping a mindset of accepting that this is my new normal and that that's okay, and there are still things I can do, and celebrating all the little wins. And yeah.
Anything that I can do to encourage others who are going through a tough diagnosis process or life-changing event to just stay encouraged and keep moving forward, that makes me feel like my journey has really been worth it. So I hope that I can give you guys some encouragement today, that your life is not ended just because it's changed. And it's a really hard and emotional thing to go through, but if you keep moving forward, it will be worth it in the end.